Hi, everyone, and welcome to today's HIV Cure Chat. Before we begin, I'd like to acknowledge that I'm beaming in today from the lands of the Wurundjeri people of the Kulin Nation. Pay my respects to elders past and present. And Sharon, I believe you are in beautiful Paris in France. Is that correct?
I am in beautiful Paris in France, except that it is November, and so it's a bit grim. Meaning it's a bit grey, a bit rainy, but still always beautiful to be here.
My name is Nic Dorward. I've been living with HIV for a decade now, and I'm the co-founder of TIM, the Institute of Many. It's a grassroots movement for people living with HIV. And I'm sitting down today for a chat with a real underachiever. I'm sorry, we tried to find someone who's a little bit more impressive for this chat. We've had to settle. I'm kidding, of course. We're incredibly honoured today to be chatting with the wonderful Professor Sharon Lewin, who is the director of the Doherty Institute and the president of the International AIDS Society. Hello, Sharon, and welcome to the chat. Thank you so much for taking the time.
Great to be here, Tim.
Let's start with a bit of a check-in, because last time you and I spoke about HIV cure research was, goodness, I think it was probably about 4 years or so ago, maybe. And I know a lot has changed even in the world of HIV cure research, but the world has changed so much since then. We'll get on to all that's the world of cure research in particular in a second, but let's start with the really obvious. I think COVID has had a huge impact on the world. We've seen a lot of geopolitical changes, especially in the last 12 months. You've got a lot of really great points to make about why we should be feeling optimistic about that. But before we get into that, I did want to check in to see what the lay of the land is for the fight to end HIV, to end AIDS, and to get a cure over the line. How has COVID and the conflict in Ukraine been impacting that fight?
So when you talk about the end of AIDS or the end of HIV, just to unpack that a little bit, that can mean ending new HIV infections, ending people dying of HIV-related illnesses, or both, or actually completely curing people of HIV, meaning that they don't have to be on treatment lifelong. So when we talk about the elimination of HIV or ending HIV, most people think of it as ending new HIV infections. And we haven't done that. So numbers of new HIV infections are decreasing globally, but we're still, in the last year, had 1.5 million new HIV infections, down from previous years, but nowhere near the targets that we need to get to in order to reach a goal of virtual elimination. In contrast, in Australia, yes, we are seeing declines in new HIV infections. With COVID, the impact of COVID was actually quite variable around the world. There's quite a lot of evidence that prevention services for HIV were actually impacted. So there are many countries experiencing increases in HIV infections, so going in completely the wrong direction. On the second level, can we stop people getting sick from HIV or progressing? And that means getting access to treatment. And we're sitting now at about 70% of people accessing antiretroviral treatment globally. The goal is to get to 95%. So we're really still way off that target. During COVID, there was less disruption actually in people accessing treatment from, there was variability across the world, but less evidence of disruption accessing to treatment as opposed to prevention services. And the last bit, the holy grail, is to actually cure people of HIV so they no longer need to be on treatment lifelong. And that's really what we're going to talk about today. That's a big scientific challenge. We don't yet have the tools to do that. In contrast, we actually have the tools to end HIV infections and end AIDS-related deaths. And if we can solve the implementation problem, being able to implement what we know works, we could do both. But ridding someone's body of HIV once they're infected, that's really the big scientific challenge. And that's what we mean when we talk about cure.
Thank you so much for that update too. And well, let's go there with cure and let's focus on that. I loved the point you made at the Montreal conference earlier this year about looking to the opportunities that COVID has presented with a sense of optimism for HIV cure research. Can you talk me through a little bit about that?
Yeah, I mean, I actually talked about optimism for all of HIV as a result of COVID, but I'll preface it by saying I'm generally a glass half full kind of person. So I do tend to see things through a positive slant, but I don't think this is being unrealistic. What's changed with COVID? A huge transformational understanding of viral infections. I mean, most people you would speak to before COVID didn't really even know the difference between a virus and a bacteria, never heard of words like viral load or viral shedding or transmission rates. So the literacy is really super high. And I think that's a good thing because that means that people understand the impact of science and what it can do for people's lives, and that has a direct effect on our politicians and on funding. The second is there was an enormous investment in new science. mRNA vaccines didn't come from nowhere. They had been being developed for the preceding 15, 20 years, and it was COVID that catapulted them into the clinic, solving a whole range of issues: manufacturing, transport, understanding adverse events. So the world of mRNA has opened up a whole lot of new opportunities. And the same is true in actually other areas of therapies. And one of those examples is antibodies as therapeutics. And finally, the diagnostic world has changed completely because we're all doing home testing for COVID now with rat testing. Well, imagine if we could do that super easily with viral load testing. It would reduce the need to go to a doctor. It's very, very important for cure research because the only way, when we try something for cure, the only way we can really see if it works is if we ask someone to stop antiviral therapy and then we closely monitor if the viral load comes back. Those studies are actually quite complicated to do if you've got to collect a blood test every time and send it into a laboratory. But if you just had a finger prick test at home, you would know that day if your viral load was up or not. So I think the diagnostic landscape's going to change as well from COVID, and that's really important for cure.
That's huge, isn't it? Because that's always been such a I would say interesting challenge, I think, in helping people living with HIV understand what it would mean to sign up to cure research trials, right? And a big part of it, of course, is stepping away from the antiretrovirals we take every day that give us an undetectable viral load, which means we can't pass it on to our partners and we keep us healthy and safe. But that shift in thinking that if you sign up to a trial would mean that you're not going to have to be trudging off down to the clinic, once a week or every other day or something like that. That's another big transformational thing in the brain as well too. I mean, what are you finding on that community level? The uptake and the interest is from community. Do we need more? Do we need more people living with HIV putting their hands up for these cure trials? Is that where we're at yet?
Well, on the work that we've done, there's really high interest from the community. And actually one really interesting piece of work that we did during COVID was investigating whether the people from civil society were keen to continue cure trials through COVID. And we had a resounding yes, not to put this all on hold while we were dealing with COVID. However, we probably deal with a very small fraction of people that really understand what's happening in the world of cure clinical trials. It's not for everyone. The clinical trials at the moment are time consuming. And so that's why things like getting really easy tests for viral load would make a very big difference. There's a whole lot of different ways that people can participate in cure studies. We have what's called observational studies. So not with an intervention, but just collecting blood or tissue to help us understand the reservoir. Really, really important studies because the best, things to test and our interventions is on blood from a patient rather than using some other artificial model. And then there's a separate thing of interventional studies, which means an intervention, an injection, a tablet that could potentially alter your reservoir or alter your immune function. And that's a bigger commitment, but we still have a lot of people that are very interested in that work.
Great. Oh, that's good to hear. One thing that I've observed, in the community was when all this talk of mRNA seems to be the four magic letters that burst through to help with the COVID vaccines. And, there was a lot of chatter in the media as well that this sort of technology could really help accelerate HIV cure research. From your perspective, how likely is that? Where are we at really with the science of HIV cure? And has mRNA helped as much as we thought it would, or is it too early to call?
Oh, way too early. At the moment, we use mRNA to make a vaccine, of course. That's what everyone's had with COVID. And there's a lot of optimism that mRNA will affect the ability for us to find an HIV vaccine, which, of course, we still don't have, and rely on other tools like PrEP and to prevent infection. mRNA vaccines for HIV, clinical trials of those vaccines are only just starting, so too early to tell. And it may not, the challenge with HIV of why we don't have a vaccine is really quite complex. It's not just about how we deliver the vaccine. It's about what to target and the fact that people don't naturally eliminate HIV as opposed to COVID, which makes the HIV vaccine so much harder to develop. But what is exciting about mRNA is that it's not just about vaccines. You can deliver new therapeutics using mRNA. mRNA just basically takes over your cell and gives it new directions to start producing a little piece of the virus, and that's how the vaccine works. Or it can start producing essentially a drug, like making your body make better antibodies. So I think mRNA has opened a whole other field of work, not just for vaccination, but also for therapeutics. The one area of HIV cure research that looks more promising, and we talk more about this, promising in both animal models and some recent clinical trials, is using something called antibodies. And we, for COVID, although they're not, people know about Paxlovid and Molnupiravir, these oral tablets, but antibodies were developed for COVID before these tablets were. And that's also a very exciting area of using antibodies to target the virus, and very relevant for cure. So we've got better at designing those antibodies, manufacturing them, even administering them. Up until now, you could only give them through a vein. Now you can give them under the skin or in the muscle. So I think the antibody world has changed a lot too.
Okay. And is that a big leap from the way we were thinking about cure a couple of years ago? I think last time we spoke, I guess one of the more dominant cure theories around there was the tickle and tease idea with getting into cells and finding all those latent reservoirs. Is this a completely different area of research? Is it it's all linked, or how does it all? Have we moved away from those old thinkings towards this antibody style, or where are we at?
Yeah, I think they're linked, and basically they're linked. So what's the problem with cure? Why can't current treatment cure HIV? It's because HIV goes into hiding, and your immune system can no longer function and recognize the virus that's hiding. So we need to pull the virus out of hiding to make it visible to the immune system, and at the same time beef up the immune system that it can see that infected cell and destroy it. So what antibodies do is they largely beef up the immune system to see an infected cell and destroy it. So the two things have to go together. If you just try and tickle the virus, we haven't seen evidence that then your body can come in and clear the cell. Might be because we haven't given a big enough tickle to really stimulate the virus, or more likely it's because even when you've got an infected cell there, your immune system is not doing a great job at attacking it. And it seems that the antibodies are enhancing the ability of a person's own immune system to fight any and eliminate any infected cells. And that's really, really, really interesting, and looks quite promising in both animal models and also some recent clinical trials.
Okay, amazing. This is, how do I want to, ahead of World AIDS Day, which is always a very special opportunity, I think, for people living with HIV and people affected by HIV. And I don't just mean the people who love us, our partners, people at risk of HIV. Sharon, I include you in that. I think you're a person affected by HIV because you've given so much of your life over to finding a cure. And you're an activist. I always say this about our scientists. They are activists, whether they like it or not. hope is such an essential element, I think, for our community to keep going. Hope for us to overcome stigma, to live full lives as people living with HIV. And obviously, hope must be a massive driver in the labs, in the trials, et cetera, with our scientific allies looking for a cure. And as well, too, I think we have to always be careful of false hope with cure stuff, right? Because people living with HIV can really find themselves going down rabbit holes of false hope and stuff. What would be your message to someone who's watching this video who has been hanging on for a cure for quite some time and really hoping that to see something around the corner, before it's too late for them?
Well, my message in that setting, and I do see myself as an activist, I've learned a lot from the activist community. Well, first of all, anyone with HIV should and can have a completely normal life. So that's where we are right now in 2022. We have fantastic treatments and we have fantastic tools to prevent HIV for people at risk of acquiring HIV. So even with the current treatment options, I think there's enormous hope. People on treatment, there should be enormous hope. People on treatment live healthy, normal lives. And treatments are getting better and better, where we can now use even a single tablet, which just contains 2 drugs rather than 3 drugs. We have injectables. We'll have different other ways of giving antivirals that suit people's choice. And we must get better at making treatment available globally for people, especially in low and middle income countries. Now, unfortunately, what is a reality is that people are stuck on lifelong treatment, and we should make that as easy and acceptable as possible to give people the best quality of life. However, there is a huge scientific effort at the moment around finding ways to allow people to safely stop treatment in order to find a cure. And science moves sometimes at rapid speed, as we've seen with COVID, and sometimes it just moves much more slowly because it's a much tougher nut to crack, as we have seen with both an HIV cure and a vaccine. But I remain optimistic from what we've seen with COVID. What can be done when you throw enough money and you throw enough bright minds at a problem. We have the power to solve those problems. The science of HIV cure is progressing. We continue to learn so much from other fields. We haven't even spoken today about gene therapy and other areas. And there's a really strong awareness that this is what we need now in this phase of the HIV pandemic. And we shouldn't stop. We need to do better, and we will get there. I do think we will get there for both an HIV cure and a vaccine.
Thank you so much. I want to say that's the perfect way to end our quick chat ahead of World AIDS Day. But I also want to share some of the great news that the community might not be aware of, that the International AIDS Society is coming back to Australia next year. You're in Brisbane next year for the scientific conference. What are you looking forward to with that next year?
Yeah, so the International AIDS Society will be hosting its biannual science conference. We normally expect about 4,000 to 5,000 people. We're expecting lots of new and exciting research, particularly in relation to prevention and injectable prevention options. Given where we are in the Asia-Pacific region, I hope we'll hear a lot about how to better manage co-infections that are common in HIV. And I hope we'll hear a lot of exciting news about many clinical trials that are underway right now for cure and should be ready for prime time by July 2023.
How fantastic. That's so good. And for any community people watching, this is the science conference, but it is about us if you're a person living with HIV. And there'll be a lot of ways, I know, to engage with the work being done there, and hopefully some fantastic opportunities for that science information to be distilled out towards the community so we all know what's going on. Great. Sharon, thank you so much for taking the time out of your very busy schedule to let the community know what's been happening with Cure. It's always a pleasure to talk to you, and happy World AIDS Day.
Thank you, Nick, and same to you.